Hi, my name is Fee Laguna, and I interned at Kaiser Permanente South Bay in Harbor City. So I created a timeline to kind of help with the process that I had when onboarding and my orientation. So to begin, I attended the 480 and 481 mandatory meeting. I believe that was around April or May. And right after that, it was like suggested that we fill out the survey right away. So I filled that out and I sent it in. And I heard back from Professor Freshman on June 15th, 2021. And she informed me to send my resume to Kaiser South Bay. So from there, a couple of days after, I was interviewed by my preceptor at the time, which was Tanya Meglenti, and it was the ADA, which was Caitlin Sather, the intern that was there at the time, and a nurse educator, which his name was Isaiah. And the reason why he was there is because I was either going to be interning with Tanya or with Isaiah. So during my interview, they were all there. Right after that, in July 6th, I was informed that I got the internship. So from July to September was my onboarding process, which was about 2 months. During that time, I was doing the background check, drug tests, completing documents, and the education modules that was asked of me to complete. And I had to do a TB test and just making sure all my vaccinations were up to date and scanning that over, of course, my immunization records and everything. What did kind of take up some time was when I went to go do my drug test. I believe it was 10 drugs that I had to get tested for, and they only did 9 for some reason. So Kaiser's really big on doing everything that is asked. So I had to do a test again, and that just prolonged the process. So it could have, been shorter, but because of that, it just extended time. So my first day of my internship was September 10th, 2021, and that was also my orientation. So my first day was basically Tanya showing me around, getting my ID card. She gave me a binder, which was honestly very useful throughout my internship, and it had different information such as different extensions, how to do certain tasks that she was going to be asking of me. So it was very informational. And yeah, so I was there from September 10th, 2021 to April 8th, 2022. April 8th was my last day of my internship. And between that time, I did different tasks, and I will be discussing that. So tasks I completed. I created monthly UBT newsletters. I updated cardiology booking guidelines. I assisted with cardiology confirmation calls for consults and Echo 45s. I filed employee documents such as licenses, BLS, and job descriptions in human resources and in the admin suite. So whenever I was filing in either or, I would make sure to update any missing documents onto an Excel sheet for each department. I emailed pre-encounter flu list and SB incomplete report to department leads. I set up and cleaned meetings, paged physicians, and prepared sign-in sheets. And I assisted my preceptor in interviewing for the new student intern position for the spring semester. So while doing all these different tasks, I definitely did learn different skills, and I got to polish up on different skills. Specifically, I polished up on my Excel skills when doing the pre-encounter flu list and the SB incomplete report, because we would be sending out data to the department leads and also to the department as well. So that kind of gave me more experience using Excel, as well as when I would update the missing documents onto the Excel sheet for each department. That also gave me more experience. Well, let me polish up my skills with Excel. Skills that I had actually learned was how to use Epic, which is the electronic health record system. And I believe that was very useful because at my current job, I work as a patient access representative at a community hospital. And thankfully, because I have already had experience using an electronic health record system, it was really easy for me to kind of get adjusted to how to do certain tasks on there. So that was very useful. So contributions and lessons. I definitely feel that I contributed in different ways. Like I was always very reliable. I got everything done when asked. I showed up to each shift, which was basically Tuesdays and Fridays from 7:30 to 4. So yeah, I was there 16 hours every week. I was mindful of those around me, meaning if I saw that my preceptor had like a lot of meetings or she had a busy schedule, I would make sure to ask her if there was anything that she wanted me to do to help her out. And I was just very attentive. So lessons that I learned from my internship, I definitely learned that it is super, super important to ask questions if you're not sure about an assignment. Like it's better to ask a bunch of questions and do it 100% correct versus not really asking and then doing it incorrectly. So I definitely learned that's super important. And I also, sadly, I was very shy because it was just very a different environment than I was used to because I hadn't really worked in healthcare prior to this internship. So I was more on the shy side, but I definitely learned that it is extremely important to not be as shy and network. And I plan on fixing this at my current job now. I've learned from my mistakes. So, and then I also learned that I have a higher desire to work at Kaiser now because I had such a good experience at the internship that I definitely want to work there in the future. So future plans, career development wise, after working as a patient access representative for a couple months, I plan to apply to different positions such as positions at Kaiser, such as an administrative assistant. Skills I want to improve are not being as shy. And I plan, like I said, mentioned earlier, I plan to do so at my current job by just networking more and talking more to like the people around me, whether it's nurses or those that work in the triage, like just really like exposing myself and learning more things. And I will continue to develop and grow in the field of my desire by gaining experience in healthcare and pursuing a master's degree. I do want to pursue a master's degree. I'm just not too sure exactly what I want to study yet. I think after giving myself at least a year of working in the healthcare field, hopefully I kind of get a better idea of what I would like to pursue my master's degree in, but it's definitely something that I want to do. So that concludes my presentation. Thank you for watching.